Ralph Curtis is our PATH patient and RISE team member. And as you recall from the video, the RISE team is a group of 12 patients embedded across all the project teams. Are there other RISE team members here? Can you put up your hands? Wow, look at you. Thank you. So you'll make sure that Ralph is doing a really great job of telling all the answers to the questions. And so I've got a few questions for you, Ralph. And the first of them is, can you please tell us a little bit about yourself and your experiences as a patient using that PATH technology in your healthcare visits?
I will give it Is this working?
Yeah. Yes.
I'm a longtime resident of Coburg. I'm 75 years old. I am married to my first wife and have been for 50 plus years, which is a fortunate thing for me. And she still affectionately calls me her current husband whenever we get into a small dispute. I'm retired from a career of marketing and sales, and I have several health issues. I'm a diabetic. I have a heart condition. I suffer from the onset of osteoporosis. I have a GI condition which requires service at the St. Michael's Hospital. I also have a liver issue that's a problem. And due to a long-time passion of racing sailboats, probably 50 years or so, I have a skin condition that requires attention when it flares up. My doctor of 30 years, I approached him a little over a year ago and asked him if he was going to participate in the PATH program, and he said he'd studied it. A couple of doctors in his office were, in fact, taking on the challenge. However, his intention was to retire, and he didn't want to get started in something that he couldn't do on an ongoing basis. So he was going to take a new career move. I want to tell you right now that I'm going to delay any contact with his new career as long as I possibly can. He's the current coroner at the... but I have a new doctor and a young chap, and I had the occasion in late January to contact him and make an appointment due to a flare-up in my skin condition. After seeing the condition, he immediately arranged for a surgeon to remove the area. And while I was there, I gave him the 2-minute tour of our PATH device, and I said that whereas if he was a PATH provider, I could have taken some pictures of the area and messaged them to him, and at his decision, he could have either arranged for an appointment, went ahead and made an appointment with a specialist or a surgeon, or said take 2 aspirin and see me in a week or whatever. That's one of the parts that impressed him. He didn't say he was going to join the group, unfortunately, at that stage. So a few weeks later, on the 26th of February, I went to the outpatients ambulatory care department for their surgery department, and when I walked into the surgery department, I presented the attending nurse my device, and to my pleasant surprise, she said, "Oh, I've had some training in that, and I'm familiar with the technology." I said, "That's great." And so the surgeon proceeded to work on my skin problems, and partway through, she asked if I was a diabetic, and I said I was. And the nurse was able to say that I was an insulin-dependent diabetic. I took rapid-acting insulin with my meals and long-term acting insulin in the evening. And a few minutes later, she asked if I was on an antibiotic. And I said, well, I'm not really sure. I take a lot of pills. And the nurse said, Mr. Curtis is taking 400 milligrams of norafloxacin. He takes it in the evening, and he fears that he's been taking it for quite some time. With that, the doctor decided that was enough antibiotics at the time, and arranged for me to meet with her on the 9th of March to remove the stitches, which is what happened.
Wow. If you think forward, looking ahead, what does a project like PATH mean for the future relationship between patients and providers, Ralph?
Oh, in my opinion, we have only scratched the very surface of this journey. I think that I'm not aware of anything that has done so much to improve the information exchange between doctors, patients, and the patient's caregivers. I don't know of anything else. I think as it carries on in its journey, it will be not only a time-saving, but cost-saving measure for both the patients, the caregivers, and possibly the Ontario healthcare community. I think we're going to look back in a few years and say, you know, the Change Foundation had a great vision when they decided to enter into that sort of technology that would improve and remove the roadblocks from the information highway between the patients and their caregivers and the medical community. I liken it a little bit to, I notice we have a professional photographer here. I liken it a little bit to the introduction of the camera, the digital camera in 1975. When Kodak introduced it, it was viewed by professional photographers as a kind of an insult to their profession, and amateurs thought it was a cute toy. But now, if you own a camera, the chances are extremely great that it's a digital camera or a non-functioning family heirloom. So.
Thank you very much, Ralph.